My name is Akash Acharya, and I'm working as a faculty here with Center for Social Studies. This is basically a research organization, social science research organization, where we have faculty member working in different disciplines of social sciences. My background is I have an interdisciplinary academic background of economics and management. My PhD was in the field of health economics, and I have been working here since 2005. So it's around 9 years I'm here as a faculty. As far as the cities are concerned, I'm also Surti, so I'm kind of born and brought up in this city. As a child, I remember this city. It has been always a warm and fun-loving place. I always like to be here. I also recollect the images of some of the stress and shocks that city has experienced. One of the recurring theme that I can recall is of the rainfall and flooding. So as a child, I can remember that when we were staying in a ground floor society, it used to get floods, and it was always when you go out for the transport, you have to walk with knee deep water. Every monsoon there were this problem of waterlogging and flooding. So that was one of the things that I can recollect. Also, so related to this, what I can recollect is the disease of malaria. It was quite common, if I remember, during late 70s and 80s. It was very common. I myself remember that almost every year I used to get malaria, and then it started changing in a way that then I remember that I was getting more of falciparum, I think during late 80s, and I think this was also the time, maybe the public health experts can tell you more, where we had say migrants were coming from different states of India. And then this falciparum, PF cases were really increasing. So that also I could relate that that was almost every year that was happening. There were at least 2 or 3 times I can remember that I was hospitalized because of falciparum. Then the major.
So this was in which area you were living at?
I was living in the Atfa Lines area, and then I was living on university campus, because my father was working with university. So, but I think all over the city, the mosquitoes were a big problem. And before, I remember that when my father came to this city, maybe during that time there was this big threat of filaria also. Whereas I myself, I don't remember that, but they were telling that when they came to the city, many people had that huge feet and a big like it was a major threat, and people were very scared of getting that filaria. But since my childhood, I really do not remember, or I haven't seen such cases of filaria. Then I think the major shock that city experienced was 92 riots, communal riots. Surat was always seen to be a very city where the communal relationships were cordial and they were harmonious, and we have people from both Hindu and Muslim communities living side by side. There were areas like Randeer, and still you have both the communities have been living together. There was a kind of very strong economic interdependence for all the Hindu festivals like Kite and Ganesh, and they are the Muslims are making those things. So it was, Surat was cited as an ideal example that here is the city where as compared to Ahmedabad and Baroda, they were kind of almost endemic to communal riots. The riots were recurrent there in both the cities. You will hear stories about firing and curfew and stabbing, and this was a routine feature, whereas Surat was kind of exception, that this was not happening in Surat. But in 1992 this whole thing was shattered after the Babri Masjid demolition, and 92 Surat saw a very very ghastly riots took place, and I think a lot of people died. So that was the one of the major shocks I can list down. Then of course 1994 plague, as we all know, that Surat came on the global headlines, but the plague was also preceded by floods. So I myself can recollect that I was a college student, and we had gone for cleaning of the city after the flood, and then after couple of days this thing came, and I myself was having some sort of respiratory problems, and I was having the symptoms, and that was a very scary sort of experience, that it was very difficult to contact any doctor, because the whole large part of the city had migrated outside Surat, so most of the doctors were not there. The laboratories were closed. Through some connection we could get one doctor who also had, I remember he had come with a mask, and I was kind of he was treating with gloves and all. So it was quite scary. And fortunately I mean he sort of asked me to do some sputum test and everything, and fortunately they were all negative. So but the entire few days it was very traumatic, and the city had become kind of ghost town. It was you will see very few people on the road. It was, everything was deserted. So that was one of the major thing that I can recollect. Then what I can say that after that, and one of the, when the municipal corporation, when that came into the day-to-day consciousness of the citizens, was I think during the times of this Commissioner Rao. And this municipal commissioner S.R. Rao, he decided to widen the road leading from Chowk to the railway station, and it was a very narrow strip, and what I remember, they were calling this line Dori, and in that he took this very bold decision of demolishing the part which was not legal, and it was, series of buildings were there, and there was lot of protests. And I can remember as a college student, but he was very strict, and he sort of implemented it. The roads were widened. There was special focus on cleaning of the city. There were frequent raids on the restaurants, and they were finding stale foods and rats in the restaurants. So you had all these stories kept on coming in vernacular media. So these things I sort of recollect. And after the plague, then one episode I am forgetting the exact year of that episode, but there was some humor that the dam, Ukai Dam, is going to go bust, and one local astrologer, he had predicted this, and somehow that was circulated in the media, and there was a kind of mass exodus. The migrants left city like anything. The date was, I think, somewhere in July that he had predicted, maybe 7th July or something, if I'm right. And it was such a panic. Everybody started leaving, especially the migrant labor. And then nothing sort of happened on that day, and slowly people started coming back. So these are the things that I can recollect before the new millennium. In 2006, the major episode of the floods. During the time I was here, we were living on this campus, and I remember that this message came from the municipal authorities that everybody should climb 20 feet upwards, that big amount of huge quantum of water is going to come. So what we had to do, because we were all staying here in the faculty quarters, so we all came here on the second floor, and sort of everybody came with whatever they could, and we spent 3 nights on this floor. Everybody was kind of sleeping in their room, and we had a gas cylinder, some things to cook, so we were cooking here, and it was then water everywhere. And then
what was the level that
here, I think the level was not really that much, but still I would say around 3 feet was their level. So there was not a piece of land that you could see. Everything was water. So that was that. But in some parts of the city, the level was really very high, because my parents were staying in the city where they were on the 4th floor, but there I think the water had reached almost the 1st floor. It was that was level, and it was a very strong current of the water that it could take the bus. The whole bus was taken away by the water. So it was also very scary, and that was the time when you don't have electricity, so everybody was saving their mobile batteries. And CSS is quite locally rooted, so we have carried out good amount of studies on the Surat city. One of the major studies was carried out in 90s, where for the Surat Municipal Corporation we did the complete enumeration of the slums of the Surat city. And we have a publication in book form that is available, like in which we studied the socio-economic condition, and the faculty member who had carried out, Professor Bishwarup Das, he is from the planning field, and he's from SEPT University. He had done his education there. So that was one study that I can refer to. Then after the plague, you must be knowing Professor Ghanshyam Shah, who was the director here. He's a very well-known political scientist, and now part of our board also. He had published a book from SAGE, and that was on the plague and the city, the role of the municipal government, the city governance structure. So that is another major publication. I myself did 2 things. One thing was done in 2005, when I tried to looked at the access and utilization of the healthcare services among the low-income settlements in Surat. So what I did was I studied around more than 500 households from 22 low-income settlements, or slum-like settlements from the city. Where one of the things which was striking was that the proportion of home births, it's more than 50% of the people reported that they are still doing home births. One of the things that we came to know that while we cite the standard statistics, rural, urban, these statistics, they mask the intra-urban the inequities. So some of the statistics or some of the healthcare situation in the urban slums is as bad as rural, or sometimes even worse than rural areas. Whereas when we think from the policy perspective, general tendencies to overlook the urban areas, thinking that these are the areas where you have all the healthcare facilities available. You have the urban health centers and private doctors, and which is true. But in terms of the access and utilization, it was it's not the it's not really helping that much. We also found at least at that point of time is that utilization of the urban health centers run by the municipal corporation was not really that good. People were not going to the urban health centers. Why? We could get multiple reasons. Though you have the qualified doctors there, you have the fee structure which is very reasonable. I mean, almost it's like free, but still low income people, poor people, they do not go there. One reason that we could find is that the inconvenient timings, because what might happen that for the daily wage laborer or the factory workers, that though he just have to pay 5 rupees, but he will have to forego the wage for whole day, which would, so if you look at the opportunity cost for him, it is turning out to be 150 to 200 rupees for going to the doctor. Whereas he can go to the private practitioners late in the evening after he is back from the work, he might take 50 rupees, but still he is better off overall. So he has his own rationale for so going to the private practice. Another thing was also the treatment, the way doctors talk to them. They were say finding it quite rude, and behavior of the private practitioners, they were finding it more better, polite, soft with them. So these were the kind of reasons why they were going to the private practitioners. So that was the study that was done. And then after the flood, we did a very quick kind of, not a very statistically representative, but just to get the perception of the people about the entire episode, and to try to ascertain some amount of loss, economic loss. We did a very quick survey in all zones of the city, and what we could gather that large amount of losses were there, and the significant proportion of the property and the losses were not insured in the first place. So you don't have any records, or you really don't know what exactly how much. Whatever records that you can get from the insurance companies are limited, but the realistic loss, the magnitude of the loss is far more than what we get from the secondary sources. Also, there was a very strong feeling among the people that this flood was man-made, and it was not just because of more rainfall, because of the mismanagement of the dam, and because of the violation of the rule book, and because politicians wanted to have full reservoirs, and because of that they this entire thing happened. So these were some of the perceptions that we could get from the people. And one study that I am currently working is also related to the Surat city. It's a very broad study funded by the ICSSR, that is Indian Council of Social Science Research, and we are looking at the city, capital and labor, in which different faculty members are looking at different components of the study. So what I am looking at is the occupational health dimension of the textile and diamond workers. And this is a kind of work in progress, but a lot of things are I feel that they are quite sort of striking as to we really don't have any proper secondary database. For example, if I want to know that how many looms are there in Surat, so you have multiple, say, the authorities like factory inspector, and they will not have the full list. And then you have the Shops and Establishment Act, where also you don't have the each loom is not registered. So you really don't have say in terms of the registration data is quite incomplete. And that's also true for labor, because the large proportion of the labor is on contract, not on directly on the payroll of the factories. So you don't have the data on that. And then consequently you don't have any records of their health, and you really don't know what is happening to them, what kind of diseases they are facing. So we are trying to explore this. We are trying to talk to the workers who are working in the textile industry. And in textile we have categorized working on the looms and dyeing and printing houses, and in the embroidery sector, and people who are working in the diamond industry, and what kind of health issues they are facing, where do they go. One thing is very clearly coming out, that they don't have much idea about the ESIS, the employee state insurance scheme. Because most of them are on contract, so they are not covered under the scheme. If you go to the ESIS hospital here, you will see that that's also highly underutilized, because you don't have that many workers who are registered in the scheme. So these are the problems that we are looking into. I think what I know now, that they have changed the timings of the USC. They run two slots for OPD. So one is in the morning, which is 9 to 1 or something, 12, and then one is in the evening, which is 4 to 7 or something. So which is, I think that that is a step in the right direction, and it will certainly help people who have this complaint. Also, I feel that if still they can have it till late evenings, because if you take a stroll in these areas, all the private practitioners, you will see that their shutters are down in the afternoon. So they have they know the demand, so they are working either in the early morning or in the late evenings. So that suits the working population. But still, I think the corporation has taken the step in the right direction, and some sort of flexibility has been introduced in the timings. So as I told that this complete enumeration of the slum we had done for the Surat Municipal Corporation. That was the study that we had carried out in 90s. Then there was one study was carried out on the door-to-door garbage collection. This was the scheme started by the Surat Municipal Corporation, and a couple of faculty members have here. They have done a kind of monitoring and evaluation of this scheme. So that was another partnership with the municipal corporation. Apart from that, I don't remember any studies. We had submitted proposal for street vendors, and trying to study their socio-economic condition, but somehow that we couldn't work out. And the another association is of course the Surat City Climate Change Trust. We are part of that, so that is another association we have with the corporation. But we share good working relationship with them. Sometimes their officials come here whenever we have the seminar here, which is of interest to them. So we have them on our mailing list, so we have that kind of interaction. Yeah, I think that this is a very unique kind of pioneering initiative, and you don't have the parallel of this as the city. If you to study the rest of the cities, we are ex officio members. So when this trust was formed, I was the then director, Professor Devi Prasad was a director here. Now he's working with TISS. So he was part of the inception of the trust. So I really don't know much about how it started, but since last couple of years I have been nominated by the current director, so I go for the meetings. But I think that's a very good way that all the stakeholders are collaborating. One of the reasons I feel that why this is happening, that there was already a kind of working relationship among many of them, like NIT, we have relationship, university also, and the municipal corporation, the chamber of commerce. So there have been instances where we keep on meeting at different forums. So that way it was there. Also the size of the city is, I think, another thing, that it's not very huge metropolis like Mumbai or Delhi where you don't know people. Here most say people from these organizations, they already know the people from different organizations. So there is some sort of wavelength or network is already there, and the trust is building upon that. So I think that's really good initiative. Well, one thing, since I also work in the field of health, so that way I find that UHCRC is also very good initiative. And when we talk of climate change, health implications of the climate change are very much relevant. Also when we talk of resilience and how to manage the stress and shocks, at that time also the building up the health resilience can really contribute to the overall resilience of the city. So I feel that some if we can do more studies within UHCRC, if we can explore this climate and health relationship, and what are the causal the pathways between the climate change and the health implications of it. So as a group and as all trustees, if they can think of some more projects, if we have some more studies that can really contribute, and then we can be we can provide learning and lessons for the rest of the cities. So we can build a model which can be replicable to the other cities, not only of India but South Asia. So that's also, Surat is considered to be 4th fastest growing city of the world, and there are a lot of such things. So that way, from the social science point of view also, I find that Surat is a very good laboratory, and a lot of things can be done, a lot more studies can be done on the city. And in that, the research institutes and the people and the trust who are based here, they have a strong bonding with the city also. So if they can be part of that, and more work should be done on the city. No question, because media plays a very key and crucial role in the this entire city level things. If I can recollect that during the communal riots, there were stark differences between vernacular media and the mainstream English media, and the kind of reporting that were done by both the media were quite different. And there were like some of the humors like poison in the municipal water, and those things were kind of promoted by media, some of the vernacular newspapers. But I think that now, if I look at the kind of reporting that media is doing now, I somehow feel that there is more maturity that they show, especially the vernacular media. I think they have toned down, and they're not really sensationalizing the issues, and there is more responsible reporting, I would say now, what they are doing. But still there is scope to do much more. I feel that while we are working on this resilience issue and the 100 RC and SCCT, there has to be a way whereby we can engage with the media, we can brief the media, and we can take media on board. That will, I think, be really, really helpful in terms of the in developing the overall strategy. That's also quite interesting question. I can recollect that when we were here, and when the first thing, when the floods and the water started receding, the help came from the people, and especially from the low-income localities. We could see that they were coming in rickshaws and in tractors. They were coming with all the help available. Also, I think in that language was not the common link, because most of them were speaking Hindi. So, but the spirit of the city, there is something like which city bounces back. And what we can call it social capital, we can call it the network of the people, the common kind of passion for the city. And I'm not sure that. Sorry, excuse me. I'm not sure whether there is any kind of study on that. In terms of literature, I'm not very sure that we have something on that. But that could be a very worthwhile area to pursue. This is something that we should study. That why? What are the factors that is contributing to this this social capital, and how we can further capitalize and leverage on that.
Right.
That could be a part of resilience.
Yeah, that's very, very, very important. Community-based resilience. Yeah, that's true.
That's the culture.
Culture of the people. Yeah, because the way the city bounced back after the floods, the kind of situation in 2006 was really horrible. People had written off the city, and in few months it was completely with all the zeal it bounced back, and all the diamond textile industry, everything started working. So that was tremendous, and this was the whole thing was done not just with the help of government support, but there was a lot of things that were completely indigenous and community driven, and that's the key, I think.